what do you make, just first of all the doom mongers who've been talking about this all this time, who are saying, yeah, time for us to not meet indoors, to not wear, to not show our faces, wear masks again, and to take the same precautions that they think that we should have been carrying on for the last 2 years. It's almost like it never ends.
No, Julia. Well, look at yesterday in Westminster Abbey, Nicola Sturgeon was there maskless. And the law in Scotland actually is that in kind of places of worship, it's a legal requirement to wear masks. So
but COVID got the memo, Jamie. COVID knew that she was in England.
Indeed, this is just bonkers, Julia. I think just some common sense, really. I think the stats that ONS released yesterday have shown that about 64% of people who are testing positive are continuing to self-isolate in England, even though there's no legal requirement. And the stats quite revealing themselves, Julia, because during the whole of the pandemic, it never really got much higher than 85%. So there have been people who haven't been self-isolating. Just some common sense, really.
I mean, and these are polling. They don't know for sure. I mean, look, there are loads of people who are not testing at all. I mean, I'm not. I've gone to 2 events in Westminster in the last couple of weeks. And so we'd like you to test before. I go, no, I don't want to. Thank you very much. And I've not done it. I haven't got COVID. I know I don't have COVID. I had Omicron in January. I don't have it. So it's a waste of everyone's time, frankly. But most people won't be testing. But often when people do test and they know, when they talk about how they're not self-isolating, we mean that they've taken the dog out for a walk, or they're living with their kids and they've dropped their kids off, but they haven't come into contact with other people. Most people are actually very responsible. But what they mean is they've not completely cut off every contact with the outside world, as often people don't when they have flu.
No, and that's kind of where we've got to. I think the government have issued, they updated their guidance now, Julie, yesterday, though, to encourage people to self-isolate even if they've got a cold. And Dr. Hilary Jones was talking yesterday saying that we should continue with testing to be able to identify the difference between COVID and hay fever. Now, if people are concerned if they've got hay fever or COVID, it kind of does show what you just talked about, the fact that COVID is not the same deadly virus that we had 2 years ago.
And that's from someone, you crunch the stats. This is not you're not a COVID denier, nothing like that. This is, the numbers are quite clear. The official data shows, we know the vaccines work, and we know there are lots of people with prior immunity, and we know that we've got a much, much, much less lethal variant, which has dominated, and even the B variant of the Omicron is even less of a risk. This is not as serious a disease as it once was.
No, but I suppose the main concern for some of the doomsayers at the moment is that we are seeing increases of patients going into hospital, and that's kind of a success and a failure of the vaccines in a way, Julie, because they were successful with the booster rollout in the winter, keeping older people out, but we know they kind of wane after 10 to 12 weeks, which is why the government's got a booster rollout for those elderly people. So I'm sure when the kind of that starts going out, we'll start seeing a reverse in the numbers there. So overall, we can't be having this virus where people are saying continue to self-isolate, continue to stay at home. And the free testing's coming to an end.
Well, that's it on Friday. I mean, people are still going to be able to get free tests. They work in the NHS or in a care home or care home residents and patients, but not visitors. It seems to me that a lot of care homes actually are requiring people to test. And I think I was going in to visit an elderly relative in a care home where everyone is very vulnerable, and I'm out and about all the time. I wouldn't consider it unreasonable to take a test in those scenarios. So why are those not being made available?
Then that's where the government policy's again gone a bit wrong there, because offering free tests to the residents inside is pretty pointless if somebody goes in with the virus. You want to be stopping the virus getting in the first place. Prevention's better than cure, Julie, as we know. So I think the testing thing, we people are talking about testing's been coming down. We're still reporting over 700,000 tests a day on the government dashboard, and most of the people I know who take lateral flows don't even upload their resulls. So God knows what actual.
I think I've only on a couple of occasions uploaded my results when I've been legally required to. It's quite bizarre. Again, most people aren't. And again, we know from the stats, looking at the number of children who go to school and the number of lateral flows that are registered, most parents weren't testing their children when they were told they were advised to for twice a week. They just simply weren't doing it.
No, and the JCVI have said, the vast majority of children have actually had the virus
Yeah.
now, over 90% probably by the end of January, they were claiming. So with the vaccine rollout for children going out at the moment, not for me to advise, people should go and seek their own medical advice, but the risk is very, very low for children, and people should really go out and look at the information before going ahead.
I have to say, I'm still horrified whenever I see children being masked. It actually turns my stomach. And I suppose my big worry, and we're still seeing people, again, there's a lot of sort of, the theatre of wearing the masks, and we know an awful lot of it is theatre. I mean, certainly, I would say to people, if you're worried about it, you should have an N95 fitted mask or better. If you're just wearing a piece of cloth or the paper mask, the evidence, you've looked at the data, people keep saying to me, I'm spouting lies, and the evidence that these masks do anything whatsoever is, I mean, minimal doesn't do justice to it, does it?
Well, look in the official figures at the moment, Julia. The highest COVID rates are in Scotland.
How could that be?
That have kept the mask. I'm not saying masks cause COVID, but what we can see is that when we've seen masks in Wales and Scotland and not in England over the past year or so, there's been very little difference in the rate, and sometimes higher. So, the facts of the matter is people are saying the masks there that people are wearing, they're not medical grade masks.
It says it on the box. It says it on the box, doesn't it? Just finally, I must ask you what's going on in Shanghai at the moment. Half the city, over a 5-day period in lockdown. The other half, 25 million people in lockdown. So they're going to mass test the entire city. Lots of other cities in China throughout the last years have been put into lockdowns. Not as long as Wuhan in the initial stage of the pandemic, but they are still pursuing officially a zero COVID policy where even just get a couple of hundred cases, they lock down. Is that tenable to continue?
I don't think it's terrible. I suppose China would argue that they've done a pretty good job because they do have proper stringent lockdowns, and those are the kind of lockdowns where people, I think, get arrested if they leave, if they're in an isolation point. But that is not how we want to live our lives, Julia. People, when you're born, you want to live a life, not be locked down. And even New Zealand and Jacinda Ardern has kind of rode back now and getting rid of vaccine passports and vaccine mandates. So I think most of the world is waking up to this. You can't control the spread of this virus. And I think China at some point will realise that as well, I think.
Trouble, of course, they've got is a very low vaccine rate among elderly, and the vaccine they have been given is the rubbish Chinese one. And therefore we may end up seeing, genuinely, we could see millions of deaths in China because of their huge population. It's really quite terrifying.